Recording the abbreviated IV competency during the COVID crisis. So student will be in uniform, student will state their CG wipes, check orders, gather supplies, wash in, identify the patient to identifiers, identify yourself with your title, provide privacy, explain the procedure that you're starting at IV, verify that they don't have a contraindication, mastectomy, recent PICC line, something like that. And then also safety, check allergies, make sure there's no contraindication. You're gonna prepare your IV in your bedroom. So I'm just using my cart as my bedroom. And I'm gonna get out my IV solution, check it against my MAR, check the solution for clarity, expiration date, make sure it's intact and it's the correct solution. I'm gonna open my tubing, close my roller clamp, lock my roller clamp. I am going to, without touching the sides, I'm actually going to go ahead and spike my bag, prime my, fill my chamber 1/3 to 1/2 full, prime my tubing, getting all the air out because that is a never event for joint commission. It's kind of hard to see, but I've got it dripping. I'm priming my tubing, getting the air out of the hub, watching it go. Okay. If your pump is going off with air in line, it's probably that you have air in these hubs. Okay, so I'm going to turn my roller clamp off. Additionally, you need to prime your J loop. So you can either prime that with your IV solution or just with some sterile saline. When you take it out of the package, it is considered sterile. Punch that right in, give it a prime, get all the air out, and then you can actually just put it right back in that sterile package. The last thing I'm actually gonna prime is I'm gonna use an alligator clamp, up to you. And again, I'm just gonna prime it. I've already kind of primed it, so it's kind of coming out. And put that back in its sterile package. And I am moving quickly because I'm out of storage space on my computer. So I'm gonna come over to the patient, wash in, identify the patient, provide privacy, explain the procedure again, and verify that the patient can have an IV in this arm, okay? So let me see where's the best place to do it. Okay, so I've got my angiocath, I've got my gloves, I've got my tourniquet, my dressing. I'm going to have everything ready to go and have it all set. Okay, opening my dressing. And I have a piece of tape handy to secure my catheter with. And I always just tuck under one edge, just so it's good to go. Okay. I'm going to identify what vein I'm going to use, put the tourniquet on. Pretty snugly, kind of identify the vein I'm going to use, take the tourniquet off. I'm going to clean that vein. Just do it in a bullet pattern. Once I go to the outside, I'm not going back to the inside. If this would become dirty, I would actually get a second one. Okay, I have my everything ready. Dirty procedure, dirty gloves. I would change my gloves at this point. Putting on a pair of gloves. This is not a sterile, but it is a septic procedure. You want to have good aseptic technique when you're putting in the IV. I would do my third check now at the bedside. I don't know if my gloves are going to go on. kind of melted. Okay. And then let's move that over. I'll go ahead and put my tourniquet back on my patient. I have my vein. I have my gel coat. I have cleaned the arm, 15 seconds. I'm going to warn, I've done my 3 checks. I'm going to warn the patient of a poke. I'm going to go in at about a 15-degree angle, just a smooth stick. When I get a flashback, I'm going to just kind of advance my catheter, which this arm is not letting me advance it, but that's okay. It's going to happen. These rubber arms are tough. And then you can actually just lure lock this on and secure it with your piece of tape that you have handy. Okay. So now I'm going to actually put on the dressing. And you want the dressing to come up, covering the blue entirely, but not going over onto the tubing. Okay. And then just secure the dressing. You put a date and time on the dressing. And then I like to connect, you can either connect this right to your J-loop. I like to use an alligator clamp. And I'm just going to go ahead and use my alligator clamp and connect it to my J-loop. And it's good to go. I would just put another piece of tape on here to secure my IV. Start the flow rate, monitoring the patient for the first several minutes, and check on him. And that's basically your competency. Okay, so you have to record, how the patient tolerated it, where the IV is, etc. So you can look at all the documentation guidelines. You document it just like a med on the MAR. Okay, remember, you're not allowed more than 2 pokes. All right, but on this competency, you'll only need 1. Okay, so that's putting the IV in, and I hope that's helpful. Have a good afternoon.